I would like to say to all women 21 and over that the Pap smear is very important, just part of your routine health maintenance. If we continue on that every 3-year evaluation and everything's normal, that reassures us that what could be, a process that could be life-threatening down the line. In my experience, in my training, the patients that came in with advanced cervical cancer usually they're ones who had not been screened. And that's, once you get into cervical cancer, that is a very serious process with unfortunately high mortality. And with this screening, we can prevent from getting to that point. Now, it is possible for a young lady with their first Pap smear to have an abnormality that may be cervical cancer. That is an extremely unlikely and rare event. It's usually someone who's unfortunately who's fallen through the cracks or just not adhered to the recommended screening.
It's really important to me to be screened and have wellness exams regularly as a mother. I probably, like most military members, need to have them annually as opposed to once every 3 years or so, but I'm glad and grateful that the military requires us to be screened so frequently because it allows us to be accountable to not only ourselves but our families. And if something were to happen to me, I would want to have as much awareness, knowledge, and be given as much notice as possible to be able to try to take care of myself so that I'm there for my family.
Yeah, we start screening all women for cervical cancer at the age of 21 when they should have their first Pap smear, and that continues every 3 years until the age of 30. At the age of 30, we add another test to the Pap smear, and that's testing for the HPV virus. That virus essentially causes all cervical cancer. So if we have a patient who has a normal Pap smear and a negative HPV testing, that screening can be pushed out to every 5 years. The HPV vaccine is available to all women starting from the age of 12 up until the age of 26. And we actually recommend that vaccination for men as well. It is effective against 4 strains of the HPV virus, 2 of which, 16 and 18, are believed to cause about 80% of cervical cancers. So this vaccine was designed to be a cancer-preventing vaccination. Cervical cancer is really a slowly developing process, so we frequently see abnormal Pap smears and abnormal cells, but going from that point to cancer can take quite some time. That allows us the opportunity to intervene with in-office procedures that can treat that and make it not an issue going forward in the future.
And I value any testing or screening for cancer, period. It doesn't matter what type of cancer it is. This is one of those screenings that is very quick, very easy, although it can be uncomfortable having someone perform the screening because it's such a quick time. The risk and reward is it's definitely worth every moment of that little bit of uncomfortableness.
We understand it's not a comfortable visit for a lady to have, definitely very necessary. I think what we do to help it be a little more tolerable and pleasant is that it starts with our front desk staff. We've got a really great team in the clinic, and from there our medical assistants and then our providers all understand that the benefit of it, I think, far outweighs that. The discomforts is if we find an abnormality, we can often intervene long before we need more radical procedures in the future. I have a wife and 2 children at home, so I understand how busy life can get for some moms, and not wanting to go to this 30-minute visit that's quite uncomfortable can be a challenge. One service we have at the hospital that can help is the Teddy Watch, which they can watch your children from any of the visits up until noon. But by doing this process every 3 years, as long as everything is reassuring, allows us to have that peace of mind that nothing is abnormal. Or if we find abnormalities, then we can intervene and prevent us from being in a situation years down the line where you may not be around to take care of those little ones.
If you have an opportunity to take a Pap test, you definitely should. There's no reason not to, especially when we have the amenities right on base, and we have these great doctors right here at Blanchfield. They make us feel comfortable here. I feel comfortable here like no other hospital or with no other medical personnel that I've ever been with. And I'm one of those people that frankly prefer to have female doctors over males, but here the males I've encountered have made me feel 100% comfortable to be able to have a pap test, and so I'm grateful for that. And so I just say I just encourage everyone to find a doctor that they feel comfortable with, and have a pap test, because it's what's best for you and your family.